Dr. Charles Guglin is a board-certified general surgeon with 28 years of clinical experience. He specializes in acute care surgery and has transitioned to preventative and functional medicine, focusing on, I know everybody in this room wants to hear about this because I'm dying to, hormone replacement therapy. Very controversial topic, but yet it is gaining so much more ground recently, especially for all of us going through the big M and the perium. All right, so, and also, Dr. Guglin has a very specific connection to Jara Landon, who again can't be here because her brother-in-law came in to see you, right, at Hyperfit, and he couldn't walk, and you helped him get back to his normal self and health, right?
He helped himself.
But it was you. Okay, so Dr. Guglin is going to give us like a quick overview about what he does in terms of hormone replacement therapy. And if you have any questions, we are going to open up the floor for questions as well. There's Penny. Okay. All right, Dr. Guglin. So tell us, first of all, for anybody who is not on hormone replacement therapy, but is thinking about doing it, what are like the top 1 or 2 or 3 things that we really need to know? Let's start there, because I'm not really familiar with it, and I think a lot of people in this room are not.
Well, first of all, the science has been done about this stuff. There's a lot of myths out there. Most of what we do in our practice, quite frankly, is myth busting about hormone replacement therapy. Most of the stuff that you've heard out there constitutes a huge confirmation bias and hot flashes that are the baseline cause for the myth about estrogen and breast cancer. First of all, nobody talks about testosterone in women. So most of what we do in our practice about myth is myth busting, and one of the things that people don't know, including your physician, is that bioidentical hormone replacement therapy, isomolecular hormones, carbon for carbon, the same hormones that you guys are cranking out right now, except for maybe the perimenopause.
Yeah, maybe.
Are the secret to health in old age. Okay? Think about this. Close your eyes for a minute. Close your eyes for a minute. Put yourself in that room in your house, the one where you go to read a book. Okay? It's snowing outside.
Is there a room like that in my house?
All right, then put yourself in a Nancy Meyers movie where there's a room. Okay? You're Diane Keaton and you're wearing a fluffy sweater and you're sitting in front of a fireplace and it's snowing outside. And that person that you love the most, man or woman, comes into the room and walks by you and just for a moment leans over and brushes your cheek with their lips, okay? It's not a kiss. They're just telling you that they see you and that you're there. Right? Now connect with that little frisson that goes from your brain to your heart to your lady parts. What is that? It's libido, right? Postmenopausal women lose libido. Okay? Postmenopausal women lose intimacy in their lives. Men get older and they become impotent or they lose libido and they have erectile dysfunction. Women get older, they have painful intercourse, dryness, vaginal dryness. They lose their libido and they become 2 people traveling the world parallel. We bring intimacy back to marriages all the time in our practice. It has a lot to do with hormone replacement. Women need estrogen, progesterone, testosterone. Nobody ever talks to you guys about testosterone. Women fucking love testosterone. It helps you build muscle and maintains your bone mineral density. It's critically important to health. Think about riding a bike with your children, okay? What does that take? It takes muscle mass, bone mineral density, God forbid you fall, proprioception, position sense, and flexibility. What do we lose when we get older? Muscle mass and bone mineral density, estrogen and testosterone. proprioception, and flexibility. Yoga, that's cool, right? Yoga's great, right? But you can't do this stuff without having the muscle. I got 85-year-old women in my practice doing weight training 3 times a week. Okay?
That's who I want to be when I
Progesterone.
grow up.
Yep, what's that?
So that's who I want to be when I grow up.
Absolutely. Progesterone is the key, quite frankly. Your GYN doctor, and if there's a GYN doctor in this practice, I apologize. You're probably woke if you're sitting here anyway. But one of the things that has happened in allopathic medicine is that we have abdicated your care to the GYN community. They're amazing to delivering your babies. They're amazing at, God forbid, taking your stuff out if it goes bad, right? But in terms of your hormonal health, what do they have? Birth control pills. That's all they got. The GYN doc will tell you that you don't need progesterone if you don't have a uterus. Every single cell in your body has receptors for progesterone. And let's not talk about menopause. What is the treatment for postpartum depression? If you take a woman with postpartum depression, you put her on antidepressants, which is standard of care, suicide rates skyrocket. Progesterone is what stabilizes your endometrium so that if your husband slips one past the goalie, right, that egg, that ovum has someplace to go. For 9 months, your progesterone level is somewhere between 400 and 900 because that's what keeps the baby in there, all right? You deliver that baby, you deliver the placenta, and your progesterone level goes to where? 0, okay? The treatment for postpartum depression is progesterone. The treatment for PMS, okay, to a very large degree, young women are treated uniformly with birth control pills for PMS, okay? And the treatment for PMS is, believe it or not, supplements, the right kinds of supplements, diindolylmethane, things like that, but progesterone in the right quantities at the right time of the month can basically cure PMS. It's amazing how this shit works, okay? And the key, though, is bioidentical isomolecular hormones. That is the key, okay? Breast cancer and estrogen. That whole thing comes from a study done in the 1990s and early 2000s called the Women's Health Initiative. And it actually turns out what spikes the incidence of breast cancer in women on hormone replacement is not even estrogen. It's Provera, which is a progestin. The only cells in your body that have receptors for progestins are your uterine cells, and that's the stuff that's in the UTI, the IUD that you may be wearing, okay? Progestins are the principal components of birth control pills, right? And this is not a myth. This is not a conspiracy theory. This is science, okay? This is things that we know that people generally do not know. And the tragedy of all of this is that insurance doesn't pay for it, okay? The tragedy of all of this is that the secret to health in old age is maintaining the same hormone balance that you have when you're between 13 and 35, okay? How many, God forbid the 35-year-old woman that has breast cancer is typically a genetic problem, okay? How many women do you know between 13 and 45 who have breast cancer? These hormones are protective, but the key is doing it in a balanced way with very close supervision and accountability. Because what do we do in our practice all the time? What do we hear every day? I'm tired and I'm fat, all right? And we hear that every day in my practice. And another hormone that we never talk about is thyroid. Forget progesterone, forget testosterone. Let's not forget testosterone because nobody talks to you guys about testosterone. It is critical to your health, all right? But we understand in a fundamental way that at some point your ovaries are going to give out. We understand that at some point in my life, my testicles are going to shrivel up and turn into pistachios, all right? But we don't understand the fact that the other parts of our endocrine system tire out as well. What is thyroid? What sets your resting metabolic rate? The number of calories that you burn per day sitting in a chair is set by your muscle mass and your serum thyroid hormone levels. And in women, a third thing, the fact that you guys can starve yourselves. Okay? Seriously, men can't do it. We're pussies. We can't do it. We can't skip a meal. Right? But women can starve themselves, and you have to, let's say you got to fit in that mother of the bride dress, and you got to lose 20 pounds. You do it in a month. When you start that journey, your resting metabolic rate is 2,000 calories per day. If you eat 2,000 calories per day, you will not lose weight, you will not gain weight. So you cut your calories to 1,200 calories a day because you want to lose all that weight, and God bless you, you do it. You fit the dress, you're beautiful, you hit a party, and the next day you go back to eating 2,000 calories a day. During that journey, two things have happened. You've lost about 5 pounds of muscle mass, and you've reset your resting metabolic rate to 1,200 calories. So you go back to eating 2,000 calories a day. You started with a percent body fat of 28%, and when you're back to your first starting weight, you're 35% body fat. Yo-yo diet. This is about hormones.
We definitely all know
Understand.
about yo-yo diet, I would say.
It's something that we talk about.
This topic is incredible, and I wish that we had the rest of the night to talk about it.
You can talk about it forever.
No, you absolutely could, and I think it's something that everybody really identifies with. The feeling of constantly feeling sluggish, and that the weight just won't come off, or the weight is constantly coming on.
Yeah.
It's all very hormonal. So I want to open up the floor before we move on to our next panelist for a question if anybody is sitting there wondering. I mean, this was such a great, brief overview and far too brief. I'm dying to hear more, but we are on a time constraint. Does anybody have, yes?
So you have included, I guess, how do you test for like where hormones are out of balance? Like what would be where you would start, I guess, with someone?
Great question. I'm just going to repeat it really quick for the people in the back. This woman in the front is asking, how do you test to see if your hormones are out of balance? And that's a great question because I know that several of us, many of us probably have gone to our OB to get a blood test because something doesn't feel quite right, and then the results come back and the blood test looks fine and everything is fine.
Yeah.
But you know within your own self that it's not fine.
Yeah.
So I'm curious to hear this as well.
Well, what we say is that a premenopausal woman, what is said in general is that in a premenopausal woman, testing hormones is not helpful because they literally change every day. Okay? What I try to do when I'm seeing younger women, premenopausal women, is we try to get them in for blood work at mid-cycle, 14 days. Because then we can see if your progesterone spikes, we can see that you're ovulating, those kinds of things. And then if there's no answers in there, then frequently we want to see it right after your period stops. And then we can create a picture of what's happening to you hormonally during the month, right? But a lot of this stuff is empirically done because, and it's a beautiful question, because premenopausally, these hormones change day to day to day, which is why you guys are so difficult to treat.
And difficult in general.
Yeah, well, I'm not saying that in this crowd. But
Watch yourself.
right, and postmenopausally, 0 is 0, right? And so the hormonal studies that we do play a huge role in postmenopausal women, but a lot of this has to do with enormous amounts of blood work. The blood work that we do in our practice goes way beyond that executive panel that your doc does every year. We look at vitamins. In the 18th century, we didn't need supplements, okay? But now, that beautiful lettuce that you buy at Whole Foods is completely devoid of nutrients, okay? It's grown in nitrogen fertilized soil. Supplements are a critical part of our health, and it's one of those things that we measure objectively. Objective data is the key to helping somebody find health, okay? So that's part of it. We look at heavy metals, where we are buried in heavy metals. And most of these are very potent neurotoxins. What do I hear every day? Brain fog, brain fog, brain fog. And a lot of it is estrogen. Estrogen is amazing for your brain. And by the way, that stuff melts plaque. One of the reasons you guys live longer than we do is because you want to. But part of it also is
we're smarter.
Yeah, because you're smarter. And for the most part, unless you have a familial component of heart disease, you guys don't even start making plaque until you go through menopause. Estrogen is the most cardioprotective substance on the planet. And so we measure those things, okay? But in terms of actual hormones themselves, knowing where you are from day to day is not hugely helpful. It's getting a better picture of you, and a lot of that comes with seeing you again and again and seeing kind of what's going on with you, what you're taking, what you've been taking, how are you eating, okay? Do you have food allergies that you don't know about, right? Are you eating gluten and is it making you sick? I mean, all these things come into play when it comes to those kinds of things.
Well, so if you're sitting here and you're thinking, I need a full workup, Dr. Guglin, you're at Hyperfit, and how can everyone here find you and contact you to come in?
Talk to the beautiful Francesca.
Francesca.
We have cards on the table.
Cards are on the table.
Hyperfitmd.com.
Yeah,
What is
our website is hyperfitmd.com. It's all there.
Hyperfitmd.com.
we do a lot of stuff. We're a full service age management practice. We do aesthetics, we do kind of everything. And it's a family, it's a mom and pop practice.
Amazing. Well, thank you so much for all this great information.
Thanks for having me, guys.
Thank you so much. Please give me a round of applause, Dr. Power. Thank you so much.